We welcome you to our module Rheumatoid Arthritis, HCC 40 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of rheumatoid arthritis. At the end of this module, the learner will be able to define rheumatoid arthritis and its cause, discuss the criteria for the documentation of the disease, note the ICD-10 codes for rheumatoid arthritis, review the example of the assessment and plan for the disease, note the exceptions to consider while coding for rheumatoid arthritis. Rheumatoid arthritis, RA, is an autoimmune disease in which the body's immune system mistakenly attacks the joints, thus creating inflammation that causes the tissue that lines the inside of joints, the synovium, to thicken, resulting in swelling and pain in and around the joints. As it progresses, rheumatoid arthritis results in loss of cartilage, reduction of the spacing between bones, and eventually leads to destruction of the joint itself if left untreated. Rheumatoid arthritis is a systemic disease as it affects the whole body, but more commonly it affects the joints of the feet, hand, wrists, elbows, knees and ankles. The joint effect is usually symmetrical in nature. Nearly 1.5 million people suffer from rheumatoid arthritis in the United States. The disease is more prevalent in women, where it begins between the age of 30 to 60, while men experience rheumatoid arthritis later in their life. We do know that it is an autoimmune disorder in which the immune system of the body mistakenly attacks the joints. However, so far, we do not know what triggers this. Therefore, the primary cause of rheumatoid arthritis remains unknown. Since rheumatoid arthritis is a chronic disease, the symptoms occur in flashes and can dissipate completely for a period of time. It is known as the period of remission. Usually, joint pain, joint swelling, joint stiffness and loss of joint function occur. The criteria for the documentation of rheumatoid arthritis involves a physical examination. During the examination of rheumatoid arthritis, the examiner should note any rheumatoid factor, juvenile type, Feltes syndrome, specific organ or system involvement, bursitis, nodules, myopathy. The number and pattern of joints affected can also indicate RA. Other signs for the diagnosis include rheumatoid nodules, deformities of any joints, limited range of motion, gait changes, crepitus, effusions, or a low-grade fever. For psoriatic arthritis, the examiner should consider either the Casper criteria or the Mullen-Wright criteria. Casper criteria cites the presence of inflammatory arthritis with more than 3 other points from 5 categories, while Mullen-Wright criteria is for patients who present with inflammatory arthritis with negative blood test for rheumatoid factor who also meet one of the 5 subtypes. The presence of positive labs and/or radiology reports and specific factors for the specific arthropathy, osteoarthritis versus psoriatic or other arthropathy, is also considered. Let's take a look at the ICD codes for rheumatoid arthritis. For rheumatoid arthritis with rheumatoid factor, the code is M05, HCC 40. And rheumatoid arthritis is without rheumatoid factor, the code is M06.0, HCC 40. For juvenile arthritis, the code is M08, HCC 40. We should also code any underlying condition while coding for juvenile arthritis. However, in the official codebook, it has an exclude note for the following diseases: arthropathy and Whipple's disease, Feltes syndrome, juvenile dermatomyositis, and psoriatic juvenile arthropathy. For unspecified arthropathic psoriasis, the codes range from L40.50 to L40.59, and their HCC value is 40. It is important to note that osteoarthritis of the spine is reported with a code from M47 spondylosis, rather than from M15, M19. The assessment and plan should address the diagnosis and include 2 support indicators. Let's see an example of a progress note. Patient name: Rainey Facer. Date of service: February 19, 2019. Date of birth: December 29, 1958. Assessment and plan: rheumatoid arthritis stable on current treatment. Continue with methotrexate and naproxen. Labs next visit. Return to clinic in 3 months. Exception: many rheumatoid arthritis conditions have an excludes 1 note, which should be kept in mind during coding. For M05 rheumatoid arthritis with rheumatoid factor, the excludes 1 note is rheumatic fever, IOO. Juvenile rheumatoid arthritis, M08. Rheumatoid arthritis of spine, M45. For M06.1 adult onset Still's disease, the excludes one note is Still's disease nose, M08.2. And lastly, for M08, juvenile arthritis, the excludes one note is arthropathy in Whipple's disease, M14.8. Felty's syndrome, M05.0. Juvenile dermatomyositis, M33.0. Psoriatic juvenile arthropathy, L40.54. We have reached the end of our short refresher course on rheumatoid arthritis. We gave you a short introduction to the disease, identified the criteria involved in diagnosing rheumatoid arthritis, identified the ICD codes, reviewed the assessment and plan, and finally noted the exceptions for the coding of rheumatoid arthritis. Thank you for joining us.